Today we received a shipment from USAID, which is an international organization from the U.S. government that typically provides disaster relief and support to the international community. We received 78 pallets today of PPE, or masks, gloves, gowns, from Dubai. The United States has not used USAID disaster relief supplies in country since Hurricane Katrina. This equipment will go directly to support our healthcare workers on the front lines helping us fight this virus. We'll use our county and tribal distribution platforms, our shipping, the National Guard to get that equipment out to the counties to be distributed to healthcare workers. We've been able to leverage the Oregon National Guard throughout the state's response to this epidemic, and recently the President authorized use of Title 32 funds to help offset the cost of this response. Title 32 means that Oregon National Guard soldiers are being paid directly by federal dollars for this response. Well, we want to make sure that any PPE that we're putting into our supply chain to support our first responders and healthcare workers is FDA compliant and certified so that it's going to protect our healthcare workers and, as important, not allow them to get sick or bring anything home to their families. Once the equipment has been inspected and inventoried, that's when we start shipping this equipment and these supplies out to our counties and to our tribes. But we also maintain a supply for the state so that we can support state emergency operations as well as have critical push supplies to get to hospitals that may need it. This particular shipment is going to go a long way towards meeting the needs of our healthcare providers, but we can't stop bringing in more PPE to help support our response. This is going to be a really long-term event for us. In the grand scheme of things, this shipment is not going to be enough. We need to keep doing our best to get more supplies from our private partners, keep working with our federal partners to keep that supply chain moving. And we've got a lot of folks volunteering around the state that are making homemade masks and face coverings. Those are all things that Oregonians are doing, that we're doing at the state to try to protect folks throughout the state from getting sick. We really want to leverage the full force of the state government to help our counties and our tribes be successful in their response as they work to protect their communities. So we're relying on the National Guard and other state agencies to work with our communities to help them inventory PPE, make sure that they're tracking their supplies and getting it to where it can do the most good. So the National Guard is one of those tools in our toolbox, and they've been more than willing to help and jump in and really work with the communities in which they live to help support the state's response. We know today we don't have enough PPE, and we're continuing to try to put more PPE into our supply chain distribution, but the thing that every Oregonian can do is to continue what we're doing, staying home, limiting the spread, and that in turn is helping to save lives.